Encouragement. Encouragement is the topic. If you have encouragement in your heart to help other people, then the encouragement that you have for yourself is something that also can be the difference between whether or not you help others and whether or not they help you. If you can encourage, and you can encourage well, if you encourage others to do things well with the encouragement that you give them, you can give advice and you can give tips and you can guide people. But if you guide them wrong and you guide them in a way that they don't want your encouragement, then they're not going to take your encouragement or your advice and really put it to heart and use it in a way that's effective for them to have a good outcome from the encouragement or the suggestion that you give them. Encouragement is not sufficient if encouragement is something that you give half-hearted too. If you give encouragement to someone and you're not sure whether or not they take you seriously, then you need to figure out why they don't take you seriously. Because if they don't take you seriously and then they don't want you to be someone serious in your life to help them, then you're someone who needs to stand aside and stop giving encouragement or stop giving advice. Because if you simply get in the way of them having to show you respect because you're a person that they need to respect or have shown respect in the past, if your encouragement becomes unwelcome, then your encouragement becomes an obstacle to them. Especially if you're someone who encourages others in a way that's different, if you encourage yourself in a way that's different. If you don't encourage someone the same way you encourage yourself, then it's a difficult way for you to keep encouraging, because when you're not being sincere as to the way you encourage yourself compared to others, then it's a difficult way for you to keep encouraging. If you want to be encouraging, be encouraging. If you want to be discouraging, don't discourage. Discouraging can be the thing that hurts someone more than anything else. Pointing out flaws, pointing out failures, pointing out obstacles. Obstacles are going to come. Obstacles are going to be there. Obstacles are always going to surface. There's no way to get around them. If an obstacle is there, just because you point it out in advance doesn't mean that it's going to show up. If you point something out that is a problem that hasn't surfaced as a problem, then you are creating the perception that the problem will show up. It is putting it out there in the universe is not a real great way to say it, but it is looking for it is what happens is true. But when you look for it and it doesn't happen, there's relief. But the problem is, if you don't look for it, then you're not wasting energy waiting for it or looking for it or waiting to see if it happens at all. That's discouraging when you're wondering if something is going to happen, where the other shoe is going to drop, whether or not the discouragement that you felt when somebody warned you about an obstacle that may come up as being an obstacle that you actually end up facing. If you prepare for it, if you're ready for it, if you plan for it, great. But if you don't need it and you don't need to waste the energy preparing for it, what's the point of preparing for something that won't happen? If you're insufficiently prepared to be someone who could overcome problems, but you're someone who has to deal with people who present problems to you, not because the problems are real, but because the problems are their history of what they had to endure or what they had to experience when they dealt with similar problems. They had to overcome them. Or if they never experienced the same thing you're going through, but they give you advice, they give you suggestions, but the suggestions really aren't hitting the mark. The problem is that when you continue to give suggestions, you will revert to your own basic understanding of what your life is and how your life works. Your suggestions won't be rooted in fact. It won't be rooted in a well-founded suggestion to help somebody who's going through an experience that's different than yours. Your experience does not match theirs when your suggestion does not help them. If your suggestion is just rudimentary and is pretty basic and broad, it's not helpful, especially when you have to deal with the intricacies of maybe a problem that's much different than what you've ever dealt with or faced. Not one you couldn't overcome, but one you just aren't familiar with. Even people who are trained professionals that deal in mental health or deal in addiction or deal in psychology, they have to sit down with the patient and have long discussions, interactions, questions, dialogues. And from the information that the professional gathers, and it's a lot of information they'll gather, then they'll prescribe a suggestion or a solution to treat whatever ails them. These are professionals. They take the time. You have to make appointments. You sit for hours. If not, one appointment makes the problem something easily solvable by offering a treatment for the person who came into the professional to find a solution to help them. If you're not a professional, if you're a family member, if you're just an amateur is not a polite way to say it, but if you're a novice or you're just a layman, or you're just somebody who's smart, who can read articles or watch YouTube videos and feel like you acquire sufficient information to give real advice or helpful advice to someone who's going through a complex problem, you aren't being realistic when you look at how that problem is solved by professionals. If professionals take the time to really study the patient before they give advice, and then it's a long-term solution a lot of times, then your suggestions, unless they fit the mold, are not going to work. If they're broad, if they're open-ended, if you can't explain beginning to end, you're not offering suggestions, you're offering potential problems to that person who really won't know how to navigate a suggestion you gave or a solution you gave, which you may think will work simply because it works for you in your mind or in your reality, or it's something that you did for someone else simply because the situation might be similar. But when the similarity of situations isn't guaranteed because people are different and the degree of someone's problem can also vary, the varying degree of a depth of a problem can also dictate to the degree of help that somebody may need to offer or may need to seek. If they seek a solution that isn't required by someone to fulfill a required question that someone who wants to help says needs to be filled, you can't make your help conditional. Isn't true. You can make your help conditional because then people become accountable, especially someone. If you're an addict who needs help, then you're an addict who needs to find a way to get the suggestions the right way too. The addict is responsible for their own solution. Ultimately, is true. Because when a patient cannot operate on themselves when they have cancer, when a patient cannot operate on themselves when they have something going on inside that they need to be opened up, you can't cut yourself open and be the doctor at the same time. But when you can be someone who knows a lot about addiction and how to cure, yes, help people get further along. The further along is to help addicts to be open to the idea of them being an addict first and then being an addict who needs help. And an addict who needs help is not an addict who will get help. An addict who needs help and who affirms that they need help is not an addict who is guaranteed to seek help. Just because an addict talks about wanting to be sober is not a guarantee that that addict will really, really seek out help so that they get sober. It just could be the beginning of several years before they actually down the road seek help of a serious nature to really, really help them. But it could also mean that within a couple of days, that person who you've never heard talk about that or have heard talk about it suddenly enters a program or decides and does something concrete, which really reflects that their desire to not want to be an addict is something that is affirmed by an action that they take far quicker than you may have even had time to even come up with a suggestion for. People that are addicts who have been through recovery before, who have been through rehab, have been through outpatient programs, inpatient programs, have been to detox, have been to mental health facilities because they were admitted on an emergency basis with, whether or not by their own free will. If they were taken off the street because they were freaking out, and the cops picked them up, they took them to someplace that helped mental health people, but also help people who were tripping out on drugs. And people who trip out on drugs, are well known to these mental health places, these facilities, where they're released a couple of days after because they know that their mind will come back. But if you're an addict who wants to have a solution, but you have solutions in your own mind, and your own mind says that you're right about everything, that you're going to be wrong eventually, is true. But the thing is, if you keep moving forward and you keep making improvements, but you can't relay that to the people who are offering you suggestions who may have a really, really, really serious effect on your life if they cannot see that you're really improving. They could control your fate, is true, especially if there's someone who's close to you, someone who may be able to provide advice to other people that could dictate whether a choice that they make is something that's profoundly affecting in your life. You can be someone who's hurt by your own family if your own family doesn't cooperate together to try and find a solution to help you. If they're trying to help you and they say, we're trying to help you, then they need to help you in a way that's helpful, not a way that hurts you. But if they don't understand that they're hurting you And you cannot make them understand that if you're an addict who has families trying to do that. An addict can sometimes be the least reliable person to get real sound opinion or advice or information about their own state, about their own condition is true, because they'll lie. But if your family member who is an addict is someone who doesn't lie to you or hasn't lied to you, or you don't have that experience, if they haven't stolen from you, if they haven't tried to manipulate you, if they haven't tried to use you, if they haven't tried to do things on a regular basis, because that's what addiction is. Addiction is a regular presentation of someone trying to fool you, tool you, use you, and get you, pull one over on you all the time. And when you give in, that's what enabling is. You give in because you give in. Enabling is not simply saying, I'm helping you by trying to minimize your ability to be a worse addict. I mean, that's not enabling. That's trying to help somebody. Enabling is not that. Enabling, if someone says, if I want to help you, and the only way I'm going to help you is I'm going to have to stop enabling you, then you have to describe how you're enabling somebody. If you tell someone that you're enabling them because you make it possible for them to be a worse addict, then you need to find out what it is that you're doing that makes them a worse addict. If you're not doing anything that makes them a worse addict, then you're not enabling. You're doing something that's helpful because you're leaving them alone maybe, or you're doing something that's helpful if they're getting better. If they're slowly getting better, even the minute amount of better is better in the overall stake of what is a fight for an addict's life. An addict will fight for their life more than what you will see, because they're not going to sit there and fight in front of you. They're not going to cry in front of you the tears that they have, the pain. They're going to show you the pain. Just because they don't show you that they're fighting doesn't mean that they're not. And for a person to judge someone as being weak or being a liar, not someone who's sincere, or someone who's just trying to screw you over because you don't get the response that you want from them, is you being a person that's not being fair to them. It's true. So if you're someone who needs encouragement or to gives encouragement, then give it in a way that can be very helpful for you to understand that the encouragement you give is encouragement that can be an encouraging word or two simply. And if you want to help, then help in a real way. Don't just say things and then leave things alone. Don't move in a direction and not check what the consequences of your choices will be for a family member or a friend or someone who you can affect their life and their addict life in a good or bad way, whatever way. You need to know in which direction your choices affect them, because when an addict can die from their addiction and your choices can affect the direction of that end, it's an important responsibility for you to be someone who encourages and helps in a correct way, in a right way, in a better way. And correct doesn't mean that you're wrong just because you're trying to help and you think you're right. It's right to help no matter what. No matter how wrong you might be, isn't true. It's right to help no matter what. It's right to have the mindset that you're trying to help. It's right to believe that you're trying to help when you sincerely believe you're trying to help. But if you take a second look and you figure out that maybe you're not being as helpful as you think, or there's something else going on that you don't know about that's giving you the short information that doesn't give you a long view of what it is that's really been going on in the person's life, then you can help by just simply leaving them alone is not true. Just encouraging them. Encouragement is the topic, and the topic is about encouragement. And encouragement is a powerful way to help someone to lift their life when their life is down in the dumps, when their life is spiraling out of control. Maybe is not true. You need more than encouragement, because words can help when somebody can help themselves. Words can be extremely powerful when somebody is helping themselves. Because if they're helping themselves, then they're finding solutions because they're staying alive and they're continuing to move forward. And if you're not the one that they're coming for help and they're still moving forward and they're still staying alive and they're still moving in a direction, and you're not seeing any dramatic failure in them that you've seen before, then you're doing the right thing, not by leaving them alone, but by encouraging them just with words. Because if you offer any additional help that's dramatic, you don't know what the outcome could be. No matter how good the offer might be of help, it can be the worst help that you could give, because it changes the dynamic of how the person is improving if you don't know they're improving. If they're not improving to your pace, then you need to have patience, believing that their life is worth giving them the time to improve. Because when a person can die from being an addict simply by relapsing one time, An opiate addict can die the first shot they take. An injection of now fentanyl white powder, which is way more powerful than the blues that people smoke. Way more powerful than heroin. Just a tiny amount, and they inject it now. And it's getting here to Arizona. It scares me how powerful that stuff is, and that people can die from it far easier than heroin overdose. Heroin overdoses are scary, and I've seen them. And heroin overdoses of any kind are scary. Fentanyl overdoses, I haven't seen one yet because I haven't been around fentanyl addicts, like heroin addicts like I did when I used. But if I use with a fentanyl addict, I have Narcan, and Narcan is important to have. And Narcan is something that you are going to have ready on hand if someone ever uses that stuff, that white powder, smokes it, injects it, or whatever they do with it. I don't really know. But if you want to be someone who encourages a fentanyl addict to get off their addict life, encouraging them not to use, encouraging them to not use less, encouraging them to go back to blues or go back to heroin isn't the wrong thing to say, but it's the wrong thing for someone to say no matter what. A lesser of two evils doesn't mean that it's a lesser. It's just an evil is all it is. So you want to encourage somebody like me who's trying to struggle for their life from meth addiction. Meth addiction is something that I struggle with, but it's something that I know that I can overcome. And it's something that I overcome every day, little by little. And it's my struggle, and I don't share it with my family. They don't know the minute details of what it is it takes to be someone who fights for their life day to day, hour to hour, thought by thought, so that I don't go down that road where I get triggered so hard that I simply choose to get in the car with the little money I have, and I go buy dope, get high in 30 minutes, and I'm gone for 5 days, and I'm shooting up loads so powerful that they could give me a stroke or give me a heart attack or give someone who has a low tolerance. It could kill someone who didn't have much experience injecting meth. The degree of shots and the size of shots that I would take. My tolerance would be so high compared to that. It doesn't kill me, but it could give me a stroke. It could give me a heart attack. But guaranteed, someone who doesn't know or hasn't had much experience injecting, take one of the shots that I could do, it would kill them. And if you can kill a person with low tolerance, then I'm risking my life. And that's the truth about meth addiction when you shoot up. So if I'm encouraging you to not be a meth addict, and I'm glad. I'm encouraging you to not be an opiate addict, I'm glad. And I'm encouraging you not to use that white powder fentanyl. God Almighty, I hope I can encourage that. And that's something that is a scary thing for me to believe that that's something that people I love, people I care about are using now. But if I encourage myself and I encourage you, then I encourage you to be someone who helps people in a way that you can encourage yourself that you're doing the right thing, and not by someone who struggles with the encouragement you give, as if it's not like pulling teeth or suffering your own loss of not being able to be heard when your encouragement and your suggestions are the pinnacle of what is right, and your suggestions are good. They can be good, but they can be wrong for the person you're trying to help. And if you're consistently and persistently giving that kind of advice and getting that kind of feedback, you need to listen to the person, especially if they're sober, especially if they're coherent, especially if you can understand them, because an addict who is not all there and not all present cannot be counted on to be able to give you real answers that are helpful, because they're not going to be thinking straight and they're not going to be thinking lucidly. A lucid person who talks about their addiction is a lucid person that can be relied on. Honesty is the factor of whether or not they can be honest. But if you've never experienced your loved one or your friend really lying to you on a continuous basis where you've caught them, then you need to have a little faith that they're not going to lie to you from now on, especially if they have a situation that is far different, if they could describe it to you or you already know, than what they've ever faced before. Life-changing situations can be the motivating things that can change someone's direction dramatically, especially an addict isn't true. Addicts can change from dramatic situations happening like getting arrested or getting hurt or overdosing in a way that they end up in the hospital for days, or just someone may just overdose for the first time, and that's enough for them. It's true. The degree of someone's need for something dramatic to happen, and what God says is something that can happen to them, and what they get is what they need for when it's their time to stop being a drug addict. So if you want to be someone that encourages, then encourage me, encourage you, encourage everybody that you run across, no matter the situation, no matter the walk of life, no matter what they do, because encouragement isn't just for drug addicts who need help, but it's also for people in every walk of life. Encourage a person who's helping you at the store, the cash register, the line backed up isn't their fault. There's a line backed up isn't their fault, and tell them they're doing a good job, or tell them they can get through. Little things like that can change someone's perspective on the rest of the day, or not hating customers, or liking their job, a little bit more, because they're like, man, people are good, people are nice, and niceness goes a long way, because niceness is infectious. Encouragement is niceness. Encouragement is also goodness, and goodness comes from love, and love is what we need to share when we encourage. And when we have family members that we love, we can encourage in a way that is full of love, but we encourage in a way that's also hurtful, when love is what we think we're leading with. And when we don't lead with love in a way that really shows love, then we're not leading with love. We're leading with something else. So I encourage you, I encourage you, I encourage you. And God bless, and amen.